COVID-19, an informational presentation from Bristol Hospice. By the end of this presentation, you will understand what COVID-19 or coronavirus is. You will be able to identify how COVID-19 spreads. You will understand what exposure means and CDC recommendations for exposure. You will have learned how to protect yourself and others against the spread of COVID-19, and you will have learned CDC recommended techniques for hand washing and personal protective equipment use. Human coronaviruses were discovered in the 1960s. It is a virus that causes a variety of different symptoms with varying degrees of severity. The two most common types of coronaviruses are SARS and MERS. Like any virus, the coronavirus has potential to mutate into different strains. There are common symptoms that are shared between COVID-19, the flu, seasonal allergies, and the common cold. This CDC infographic is a helpful tool to help understand the differences, but only a doctor can give you a diagnosis. The virus is thought to spread mainly from person to person between people who are in close contact with one another through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Some recent studies have suggested that COVID-19 may be spread by people who are not showing symptoms. Click the link below to learn more. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. This is not thought to be the main way the virus spreads, but the CDC is still learning about the virus. Wash your hands often with soap and water. If soap and water are not available, use an alcohol-based hand rub. Washing hands can keep you healthy and prevent the spread of respiratory and diarrheal infections from one person to the next. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands, prepare or eat food and drinks with unwashed hands, touch a contaminated surface or objects, blow your nose, cough, or sneeze into hands, and then touch other people's hands or common objects. You can help yourself and your loved ones stay healthy by washing your hands often, especially during these key times when you are likely to get and spread germs. Before, during, and after preparing food, before eating food, before and after caring for someone at home who is sick with vomiting or diarrhea, before and after treating a cut or wound, after using the toilet, after changing diapers or cleaning up a child who has been using the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after handling pet food or pet treats, or after touching garbage. It is very important to routinely clean frequently touched surfaces. Wear disposable gloves to clean and disinfect, and clean surfaces using soap and water and then use disinfectant. Cleaning using soap and water reduces the number of germs, dirt, and impurities on the surface, and the disinfectant kills the germs on the surface. Practice routine cleaning of frequently touched surfaces. High-touched surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, and so much more. We recommend the use of EPA-registered household disinfectants. Follow the instructions on the label to ensure safe and effective use of the product. Many products recommend keeping the surface wet for a period of time, so see the product label. Precautions such as wearing gloves and making sure you have good ventilation during use of the product is very important. Diluted household bleach solutions may also be used if appropriate for the surface. Check the label to see if your bleach is intended for disinfection and ensure the product is not past its expiration date. Some bleaches, such as those designed for safe use on colored clothing or for whitening, or for splashless application, may not be suitable for disinfection. Unexpired household bleach will be effective against coronaviruses when properly diluted. Follow the manufacturer's instructions for application and proper ventilation. Never mix household bleach with ammonia or any other cleanser. Leave the solution on the surface for at least 1 minute. Bleach solutions will be effective for disinfection up to 24 hours. Alcohol solutions with at least 70% alcohol may also be used. For soft surfaces, such as carpeted floors, rugs, and drapery, clean the surface using soap and water or with cleaners appropriate for use on these surfaces. Launder items if possible according to the manufacturer's instructions. Use the warmest appropriate setting for water and drying. Or disinfect with an EPA registered household disinfectant. For electronics such as tablets, touchscreens, keyboards, and remote controls, consider putting a wipeable cover on. Follow the manufacturer's instruction for cleaning and disinfecting. If no guidance is available, use alcohol-based wipes or sprays containing at least 70% alcohol. Dry those surfaces thoroughly. For clothing, towels, linens, and other items, you can launder them according to the manufacturer's instructions. Use the warmest appropriate water setting and dry those items completely. Wear disposable gloves when handling dirty laundry from a person who is sick. Dirty laundry from a person who is sick can be washed with other people's items. Do not shake dirty laundry. Clean and disinfect clothes hampers according to guidance above for surfaces. Remove your gloves and wash your hands right away. The link below shares resources and information on infection control processes from the CDC. People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms or combinations of symptoms may have COVID-19. Cough, shortness of breath or difficulty breathing, or at least 2 of these symptoms, fever greater than 100.4, chills, repeated shaking with chills, muscle pain, headache, sore throat, or a new loss of taste or smell. The CDC provides a wealth of information for long-term care facilities. Follow your facility's policies and procedures and infection control protocols during this time. Please click the following links to learn more from the CDC, as well as a video on how to put on and take off personal protective equipment and hand washing. Click the link below for interim guidance from the CDC on clinical care of patients with COVID-19 in facilities. Exposure, as defined by the CDC, means that a person has had prolonged, unprotected, close contact with a person who has a presumptive, positive, or known case of COVID-19. Close contact is defined as touching soiled tissues with bare hands or contact within 6 feet with respiratory secretions like being coughed or sneezed on. Prolonged exposure means the exposure was greater than a few minutes. Unprotected exposure means that the person who has a presumed or known case of COVID-19 was not wearing a face mask when they came in contact with our patient. If you are exposed to COVID-19, follow your facility's protocol. According to the CDC, it could take up to 14 days for symptoms to appear after the initial exposure. So check and record your temperature twice daily for 14 days in a logbook. And remember, a fever is considered 100.4 degrees or higher. Record and report any symptoms that appear. Cover your cough and sneezes with a tissue, and wash your hands frequently and disinfect surfaces in your home. Before you take your temperature, wait 30 minutes after eating, drinking, or exercising. Wait at least 6 hours after taking medications that can lower your temperature, like acetaminophen, ibuprofen, or aspirin. Bristol Hospice is working very hard with all of our partners to prevent the spread of COVID-19. We are screening all patients prior to visits. Our offices are still open, but we are taking necessary infection control precautions. Our staff has all the necessary PPE to continue to provide hospice care for our patients regardless of the setting. Our National COVID-19 Response Committee meets a minimum of 3 times a week. We are ensuring our teams are informed and kept up to date with all information and regulations from CDC, NHPCO, and state and local guidance. Education is sent out daily to our teams. Bristol Hospice is here for you and your team during these challenging times. We are continuing to take referrals from all sources, including facilities. Please visit www.bristolhospice.com for locations and contact information. Thank you for listening to this presentation, and thank you to you, our healthcare heroes, for everything that you do for our patients. Stay safe.